As we continue to make unprecedented investments in the health of Canadians, our government will always protect the principles of Medicare enshrined in the Canada Health Act. Universal, accessible, and publicly funded healthcare is a point of pride for Canadians, and protecting it is a priority for our government. Collectively, we have made the choice to leave no one behind and deny no one necessary care, regardless of their ability to pay. As healthcare evolves, the Canada Health Act must also adapt. To this day, there have been 3 interpretation letters to that act that each have served to protect the intent of our publicly funded healthcare system. In 1985, shortly following the passage of the Canada Health Act, Minister Epp wrote to his provincial and territorial counterparts to clarify the Act's criteria, conditions, and regulatory provisions. In 1995, Minister Marleau wrote to her counterparts to provide a federal interpretation of the Act as it related to the issue of facility fees charged directly to patients receiving services at private clinics. Finally, in 2018, Minister Petitpas-Taylor wrote to her provincial and territorial colleagues to set out the diagnostic services policy and the reimbursement policy, strengthening Canada Health Act reporting. It is the responsibility of the Canadian Health Minister to apply deductions to health transfers to provinces and territories when user fees are charged to patients for medically necessary healthcare services. That is why earlier this week, the Minister of Finance issued letters informing provinces and territories of upcoming Canada Health transfer amounts and deductions, as is the normal process in advance of the CHT payments. The amounts levied a total of over $82 million in respect of patient charges levied during 2020-2021 for medically necessary services that should be accessible to patients at no cost. These deductions, which are 5 times higher than the average of previous years, include the first ever deductions taken under the diagnostic services policy, totaling over $76 million for patient charges levied for medically necessary diagnostic imaging services. This being said, and given rapid and important changes in healthcare technology and in the scope of practice over the last few years, it's also important to make sure that the Canada Health Act continues to be interpreted to support free and universally accessible health services for medically necessary care. During the pandemic, we have indeed seen new ways of providing care. While there are many benefits to these, we have also seen an increase in reports of new patient charges to access insured health services that would otherwise be covered if provided in person by a physician. It is critical that access to medically necessary services, whether provided in person or virtually, remains based on medical need and free of charge. I have reminded earlier this week my colleagues' health ministers of our shared responsibility to protect our universal, publicly funded healthcare, and that Canadians should always be able to access medically necessary services without having to pay out of pocket, no matter where they live in the country or how care is delivered. While we should strive to improve health services for Canadians, we must always ensure that the very core principles of the Canada Health Act, its public nature, universality, and accessibility, are also protected and strengthened. That is why I will be consulting with my colleagues and will be working together in the next few weeks to issue a new interpretation letter in the context of these changes. One of the ways to strengthen access to health care is through increased access to dental care to those who don't have it, starting with those who need it most, our children. Last fall, we introduced the Canada Dental Benefit, which allows eligible families to receive up to $650 tax-free per year to cover dental expenses for children under 12. As of now, the benefit has helped more than 230,000 children get brighter smiles and healthier teeth. This will make an enormous difference in the oral health of Canada's children. And it's just a beginning as we work towards a more comprehensive national dental program.